What's going on, everybody? Y'all, I know you tuned in a few weeks ago and you heard from Ruchi on what we did for a DSO. If you haven't, go listen, even if you're not a DSO. It's unreal, the strategy she dropped on us. Today, we're going to be talking about another wonderful client of ours, ARSA, Advanced Reconstructive Surgery Alliance. They're awesome, and they've got about, 30 practices under their umbrella?
Yeah, they have around 7 to 8 brands under them, and each of them have 4 or 5 clinics. So it does.
Yeah, awesome. And they are the most advanced surgeons when it comes to plastics and reconstruction out there in the country. They're doing things like phantom limb reconstruction and then hand reconstruction. This team of surgeons is not your typical run-of-the-day plastic surgeons who are doing breast augs and facelifts and stuff like that. They are repairing the most gruesome injuries, but wherever that or however that may have happened. And so the keyword strategy, when they first came to us to say, I don't know if search is going to work because people don't think or typing in phantom limb restoration, right? So Rich is going to talk about when you have a less obvious keyword segment, how do you go after them? Ruchi, welcome back to Ignite.
Hey, happy to be back.
Yeah, sure. Fake it till you make it, Ruchi. Okay. And so tell us about ARSA. So they've got 30 brands, one of the biggest plastic surgery groups in the country. Give us an example of a service they're going after and then how we targeted that less known thing.
Perfect. I think I'm going to harp on Plastic Surgery Center. It's one of the bigger brands that ARSA helps, market and get new patient leads. They specialize in breast surgeries, implants, explants, anything related to that. When we first started with this account, we were, again, the instinct that every media manager has, let's go as high intent as possible. If somebody's searching for a surgery, these are not people who are sitting here kind of giving you advice. They're actually people who are going to look at your reports, diagnose you, and recommend a very advanced surgery. So you're way ahead in your medical analysis by the time you get to a group like ARSA, right?
Okay.
What we realized was that I went to my doctor, they said that I'm at super high risk for breast cancer and I should get a test done, right?
Okay.
I learned about the test online and I kind of try to understand what it means. What does a positive result mean? What does a negative result mean? You're kind of trying to learn everything about it. So the patient journey starts way back. To capture somebody when they are trying to learn about the BRCA gene testing is when we need to get them into the door, because A, they're getting the testing done, B, then they're going to get a diagnosis done, C, they're going to probably need to meet a surgeon if they require, a breast implant or anything. So with these kind of surgeries, the earlier you kind of capture the patient in the patient journey, the more the chances are that they're going to stick with you in the long run till you help them get to a better place with their health, right? So with ARSA, instead of going for just high intent keywords, we are all over the place. We capture low intent. The ad copy is very, very informative. So if somebody's searching for BRCA gene testing, we actually talk about, hey, it's important to prioritize your health and get the test done. Just, get peace of mind or get the help that you need today. You go into mid-intent and then it's about diagnosis, right? So all the keywords out there are about, okay, now I already know the results. What the hell do I do next? And then the high intent ones where I need a surgeon who can help me with breast cancer or all the other steps that come into it. So for ARSA, all the brands that we are advertising for, mostly related to nerve compression surgeries, plastic surgery, anything related to that. The idea is every campaign has to be designed to approach the patient in the user journey at every step. And that's how we allocate the dollars as well.
So that's a genetic mutation that someone has and it means you're more likely to have breast cancer, right? And so we have landing pages that educate on that. And then when they know that, we have landing page when they search something mid-funnel, is it comparing providers at that point or treatment paths?
It's still, once you have a diagnosis, you are pretty much eligible to start talking to somebody about this,
so then they're looking for a provider.
They're looking for a provider.
All right, surgeon. All right, very interesting. All right, guys. And so that works. And so with the BRG, are you getting them into a funnel that we are reactivating through email education? Or what do we do when they submit their information through the upper funnel keywords?
Yeah. This is a clear example of where you need to go into a full funnel strategy. It's something we are working on, but right now it's all about the messaging. We are still restricted in search. The idea is to kind of just meet them with different kind of messaging at different stages of their journey. And
patient submits their information, then it gets passed on to ARSA, and then it's their job to keep them in the loop, keep them in a patient funnel, and educating them so that they come back when they are ready to choose a provider. That's generally what we do with all these complex cases that they're dealing with, right? Is like find the initial trigger point.
Yep.
And a lot of it's injury based too.
A lot of it is injury. Yeah.
Something happened and they need a facial or a hand reconstruction. And so what have we been on there? Hand reconstruction or like injured?
It again comes down to low, mid, and upper funnel. Like, of course, you had hand surgeons in New Jersey or orthopedic surgeons, but then you also have my arm pain won't go. Like, it's like when you look at the search terms there, and again, think about it, right? If you were in a patient's shoes or somebody who's experiencing that pain, I would literally type in, I have a lump. It won't go for 2 weeks. Like, so it's a lot about thinking how a non-medical person would look at the symptom and then kind of educating them from there about you need a diagnosis. Do not ignore this. This is a lump that could be concerning. Could have signs about something bigger that you're dealing with.
I love it. This is so important. I mean, this is actually getting patients the care they need before something more serious happens. Sometimes they know they actually need a surgeon, but sometimes they just need education. So I guess if you're going and you're going to be targeting these upper funnel keywords and they're like awareness and education keywords, you need a really strong patient education system after the fact. It can't just be lead comes in, we do nothing with it, right? Okay.
But then the good part is ARSA already has that in place, right?
They do.
Yeah, any organic lead, they don't expect the lead to actually lead to
surgery.
Exactly. Like it takes almost 5 to 6 months to actually close a lead.
Got it.
So they already have the systems in place where if somebody comes with a concern, their call centers are trained. They have virtual consultations with the doctors across the country where they can actually talk to the provider and understand their concern, get a professional opinion. So all ARSA needs is for an agency like Cardinal to help them drive the good qualified leads, find the right people at the right stage of the funnel, get them to their door, and they do all the hard work.
Makes sense. And a big shout out to Red Spot Interactive. They've built this whole CRM. It tracks everybody all the way through, and they actually know from the leads we drive how much revenue was booked because of the CRM. Red Spot Interactive, Jason, great guy there. All right, so that's important to understand. The other thing I'm thinking here, because they can pull patients from anywhere in the country, how the hell do we do radius targeting on this? You just blanket the country with a...
Yeah, so again, it is about understanding the business, right?
Okay.
Some of the brands, for example, IFAR, they have such specialized surgeries that people come from Canada, people come from Middle Eastern countries to actually get this surgery once they get diagnosed. They fly in specifically for the surgeries. They have such world-class surgeons for some of the specialties that our targeting is across the states. We are targeting Canada, we are targeting some of the Latin American countries because they, through their past existing client portfolio, they've noticed that there are so many people who are actually flying from other countries. So when somebody's sitting in
very specific
in a specific if they're sitting in a different country and they are researching for brachial plexus surgery, when ARSA shows up, they know exactly that there is somebody who specializes in it and they are the person I want to go to.
Ruchi talked about this on our previous episode of Ignite, but understanding the business, guys. So tough for newer platforms that don't understand where their revenue data is going to come from. But the first thing in any kind of advertising, PPC, Facebook, billboards, whatever it might be, is understanding where your patient revenue is coming from for different service lines and then working on targeting that, right? Okay. And I didn't know. So Cardinal's global. Cardinal worldwide, everybody. That's very interesting. Okay, what other nuances? I can't believe we made this work. I mean, ARSA's growing like crazy, backed by Webster, but the search worked. I mean, Ruchi, only you could have done this. I thought it'd be too tricky because their procedures are really specific.
I know a lot of fancy words.
Now you do. Now you do. And I love that we're helping people that have a mutation for breast cancer get ahead of it and not get cancer. I love that. That's near and dear to all of our hearts here. So what else with ARSA is very specific and different that we're doing?
I wouldn't say different, but I would definitely say substantial. If you look at the ARSA website, right, talking about IFAR does 20 different type of specialized surgeries that I assure we haven't even heard the names of, most of them. If you go to the website, it is very informative because of the kind of business they are in, right? Like they have to inform the people. You look at the website and I was intimidated the first time I got there. I'm like, this is a lot of information. I know I'm dealing with phantom limb, but where do I start? Where do I go from here, right? In conjunction with Strategy Co., we developed some really amazing landing pages specifically for paid traffic based on the funnel. So now if you click on an ad from a mid-funnel strategy and you go to the page that we created specifically for paid traffic, it's amazing. If you look at, we have a place, like as soon as you enter the page, you see multiple places for your patient to convert. If they already know what they are coming from, you have a form on the right-hand side. There's a phone number at the top, which again is very common for all of them. What I do like that they added was 2 different embedded videos one about their providers, provider talking about phantom limb. I am an expert. I am somebody who you actually researched and came to the website. I'm the one telling you how to deal with phantom limb. Okay. And then you scroll down. Again, there's a lot of information just to make sure that the patient understands or the user understands what they are, like what ARSA does. And then you have small embedded videos about patient testimonials. If
so
I were
provider service type stuff and then patient testimonials. Okay.
If I were ever doing something as personal as, or not even personal, like something as huge as a nerve surgery, I really want to know what happened with other patients. I want to know how they were treated, because it's not just about the service, it's also very personal. And I want to go to a place where I genuinely feel taken care of. So I think we nailed it with the landing pages for ARSA.
Yeah.
And we made sure that the user experience was very friendly, comforting, and informative, all at the same time.
Good work, Strategy Collective, on that as well. Matt and Dominique, great people over there, great team. That's interesting. So guys, if you've heard anything from Ruchi, it's that you got to run PPC really smart, and the computers aren't doing everything yet, not even close. We do that well, Ruchi does that really well, but it's also messaging, landing page copy, education, especially with these higher acuity things. I even think low acuity, like derm groups probably think, I can bid on Botox filler and that's good. I'll just set up a landing page and they'll convert. But you got thick competition there, and they probably do want to see the providers and hear from patients, because the Botox person next door just shut down. Like, you don't want to go get Botox there. All right, so this is good and relevant information. Thank you, Ruchi. Y'all heard from the best. Hit her up, except for job offer. She's smart. She's the best. And we can't thank you enough. We appreciate it.
Awesome. Thank you.